The British and the colonial countries have a way to engage in conversation with each other because they have made it mandatory that the IELTS needs to be written. This is especially important in cases of new immigrant workers coming into their country and working according to their style and system. This ensures that communication is effective and conveys the message that a particular person wants to tell another, especially in professional setups. Now coming to the point why communication is very important. There are many reasons why communication is important at the healthcare workspace. This is because patients' lives are at risk. Patients' details need to be communicated well enough with other people, as well as the documentation is important so that people can look back in time and see what actually happened in the past regarding any patient or regarding the processes of the hospital and regarding the kind of equipment that's coming in and going out. And since we're dealing with biological tissues, all of this is quite important because patients' lives are at stake and people's lives are at stake also. Coming to why communication is important, especially in the present healthcare space, is because data needs to be documented and conveyed in a easy, quick, efficient manner. It may be really funny that I'm talking about this because in my experience of about 15 years in the healthcare space, I've noticed that there are times when communication is missed, and then this tends to affect the workflow, and this tends to affect ultimately the care of the patient. So, when it comes to communication, there are various stages where communication actually happens. From the first point that the patient comes and meets the doctor or the surgeon then decides to schedule a surgery, then scheduling the anesthetic assessment, informing his teammates as well as the people in the hospital and the equipment suppliers, and ensuring that the tests are being done and ensuring that the patient flow inside the hospital is uneventful. And when it comes to uneventful, I'm talking about the kind of complications that can happen and the complications that should be averted while the patient is in hospital. So, there are times when the communication does not happen, and this may happen either by verbal or non-verbal. It may be written, it may be through phone calls, it may be through text. And it's important because doctors may not always be available for communicating with the other people of the team, or communicating with the nurses, or communicating with his other teammates or juniors or seniors. Why? Because certain parts of the hospital are a sterile space. You might have the doctor or the surgeon is performing a particular procedure. Their hands may be, gloved, and they may be in a sterile atmosphere where they cannot hold a phone or, document things in a written manner. And this tends to get delayed, and then finally the documentation never happens. So, and this is definitely not the fault of the doctor. This is a problem in the system which needs to be captured in real time so that we can make the processes more efficient. So I worked on a small topic which talks about why is communication important in the hospital, and here it is. So communication in healthcare is important because it ensures patient safety, because there are times when if the communication does not happen well enough, there can be misdiagnosis and there can be treatment delays. And what I've actually seen is when a patient is being transferred from one shift to the other, like a different set of nurses or doctors coming in from one shift, from the day shift to the night shift, or from the night shift to the morning shift. And it's inevitable. People are fatigued. People tend to miss out things. So communication is important because it prevents any adverse effects that can happen. If the communication happens in a very efficient manner, then it leads to better physical and mental health outcomes. And the patient can recover faster, and there'll be a reduced readmission into the hospital. And this is important because this is a quality indicator. If a patient is being admitted back into the hospital after being discharged, then it shows that the system has not been efficient enough, or the hospital has not delivered proper care to the patient. And if the systems are efficient, this will build trust and rapport. And it is often quite important because the patients will feel heard and they will explain to the doctor their symptoms and their concerns and all of this, because everything that the patient says might lead to a particular sign. And if we investigate that sign or symptom, we will realize that there's something else going on with the patient, and then we can investigate the patient further and therefore treat the patient better. And there are times when, let's say, there are a lot of emotions that go on in the hospital. Sometimes there's anger, there's frustration, there's sadness, there's happiness, there's, joy, there's comedy also. So, how communication tends to help is because it encourages teamwork. Only when everybody in the chain are know about what's going on, or know to what extent you can deliver better healthcare to the patient, then it encourages teamwork, and people would like to work in an atmosphere where communication happens better. And if the communication happens better, the teamwork is better, then the staff is satisfied. And if the staff is satisfied, then they are satisfied with doing their job, which makes the entire journey of working at the hospital a more enjoyable experience. So, in the longer run, when we're dealing with large numbers of patients, and mm, we're dealing with a greater burst of population over the years, this will help increase efficiency, and it will help deliver results better. And we cannot afford delays anymore because the health of the population contributes to the economy of the country.